Hello everyone, Dr. Meyers here. As we cross into our 50s, 60s, and beyond, we realize that our bodies don't bounce back quite like they used to. A poor night's sleep lingers for days, minor joint pain tells you when a storm is rolling in, and wounds heal just a little bit slower. To protect your independence and keep your energy high, you do exactly what your doctor asks. You take your daily blood pressure medication every single morning like clockwork. But here is an astonishing biological reality that is rarely discussed in the exam room. The very food you choose to eat with that morning pill can completely neutralize your medication, or worse, turn it into a dangerous overnight overdose. Today, we are uncovering 5 common morning items and habits that actively destroy your blood pressure pill's ability to protect your heart. We will look at a popular herbal tea blend, a classic breakfast platter staple, fortified juices, and a specific morning fruit option. I'll also reveal the #1 ranked breakfast item most seniors completely overlook at the grocery store that can cause a dangerous drug spike before lunch. If you want to maintain pristine cardiovascular health without accidentally working against your own prescriptions, let's look closely at what is happening inside your blood vessels. To understand how a simple breakfast choice can sabotage your medication, we have to look at how your blood vessels and organs function as you age. Think of your circulatory system as a network of flexible garden hoses. When you are young, these hoses are soft and highly elastic. But over time, our vessels undergo a natural aging process characterized by low-grade chronic inflammation and oxidative stress. You can think of oxidative stress as a form of cellular rust that gradually stiffens the walls of your arteries. When your arteries lose their flexibility, your heart has to pump significantly harder to push blood through the body. This elevates the internal pressure, which is precisely why your physician prescribes blood pressure medications like ACE inhibitors, beta blockers, or calcium channel blockers. These pills act like an automated valve control system, gently widening the vessels and directing your kidneys, your body's internal water treatment pumps, to flush out excess fluid and sodium. This isn't a minor theory. Your digestive tract and liver contain a highly specialized border patrol crew of proteins known as cytochrome P450 enzymes. Their primary job is to break down medications so your body isn't flooded with too much drug at once. A landmark clinical review published by the Mayo Clinic Proceedings demonstrated that as we cross age 60, our natural liver blood flow and enzyme efficiency decline by up to 30 to 40%. This means your border patrol crew is already working short-staffed. When you introduce certain highly active natural compounds from common breakfast foods, you completely paralyze these remaining enzymes. Without these enzymes policing the medication, your blood pressure pill is either instantly destroyed in your gut or allowed to flood your bloodstream with zero filtration, triggering profound internal stress and rendering the pill useless by nightfall. Let's count down the 5 specific breakfast elements that cause this breakdown. Let's start with number 5, the innocent mug of herbal licorice root tea. Many older adults believe that switching from morning coffee to caffeine-free herbal teas is an inherently safe way to keep their heart rate calm. The active compound here is glycyrrhizin, the primary sweet-tasting compound found in licorice root. When you consume glycyrrhizin, it travels directly to your kidneys and blocks a crucial enzyme that is supposed to break down cortisol, your primary stress hormone. With that enzyme blocked, cortisol levels skyrocket inside your kidneys, forcing your body to rapidly excrete precious potassium and retain massive amounts of fluid and sodium. For a senior taking a blood pressure pill, this entirely reverses the medication's work. The sudden fluid retention increases the volume of blood pressing against your stiffened arteries, completely destroying the drug's therapeutic effect overnight. Carefully read the ingredients on all herbal tea boxes, particularly throat coat, wellness blends, or traditional chai. If you enjoy herbal tea in the morning, ensure it is certified licorice-free. Number 4 on our list is the aged breakfast platter, such as smoked salmon and sharp cheeses. Enjoying a Sunday morning bagel with smoked lox or an egg and cheese scramble with aged cheddar is often viewed as a high-protein, low-sugar breakfast option perfect for sustaining energy. However, these foods contain a naturally occurring amino acid derivative called tyramine, which builds up as foods age or ferment. Normally, your gut uses an enzyme to safely neutralize tyramine, but certain blood pressure medications, combined with the natural slowing of digestion in older adults, can inhibit this protective enzyme. When tyramine enters your system unchecked, it forces your nerve endings to release a massive, sudden flood of norepinephrine, the body's primary chemical trigger for narrowing your blood vessels. Your blood vessels clamp down instantly like a closed valve. This can cause an acute, severe spike in blood pressure that completely overwhelms your daily pill, increasing immediate cardiovascular risks. You do not need to give up savory breakfasts. Simply opt for fresh, unaged alternatives like fresh mozzarella, ricotta, cottage cheese, or freshly cooked wild-caught fish. Moving on to number 3, the fortified orange juice and high-calcium dairy mistake. Pouring a large glass of calcium-fortified orange juice or milk next to your morning pills is often seen as an excellent way to maintain bone density and prevent fractures. Unfortunately, calcium is highly reactive. When swallowed at the exact same moment as common blood pressure medications, especially calcium channel blockers like Amlodipine or beta blockers like atenolol, the calcium binds directly to the medication molecules in your stomach. This chemical binding process is called chelation, and it transforms your soluble pill into a heavy, insoluble mass that your intestinal wall simply cannot absorb. Because the medication cannot pass through your intestinal lining, it is excreted from the body unused. Your bloodstream receives zero therapeutic support, leaving your blood pressure completely unmanaged throughout the day. Keep a strict barrier between your calcium-rich foods and your prescriptions. Practice the 2-hour rule. Take your blood pressure medication with a clean glass of plain water first thing in the morning and wait at least a full 2 hours before enjoying dairy products or fortified juices. Number 2 is the morning green smoothie potassium overload. Blending a massive morning smoothie packed with raw spinach, kale, and whole bananas is widely celebrated as a health-conscious way to naturally lower blood pressure using potassium. Potassium is generally excellent for blood vessel walls, but millions of Americans over 50 are prescribed specific drugs like ACE inhibitors or angiotensin receptor blockers such as Lisinopril or Losartan. These medications work by telling your kidneys to retain potassium while dumping sodium. When you add a massive, concentrated liquid dose of potassium from a green smoothie on top of these medications, your kidneys become entirely overwhelmed. This causes potassium levels to spike dangerously in the blood, a clinical condition known as hyperkalemia. Instead of protecting you, hyperkalemia disrupts the electrical wiring of your heart, leading to sudden muscle weakness, severe nausea, and dangerous cardiac rhythm irregularities. Eat your nutrients rather than drinking them. Instead of concentrated smoothies, enjoy a single whole banana or a quarter of an avocado alongside a balanced breakfast to ensure a slow, steady absorption rate. We have reached our number 1 offender, the breakfast item most frequently missed or overlooked at the grocery store that poses the most direct threat to seniors. Grapefruit is an absolute nutritional powerhouse, but from a pharmacological standpoint, it is a metabolic wrecking ball. The active compounds responsible for this are unique chemical derivatives called furanocoumarins. These molecules possess the unique ability to bind to and completely destroy the filtration enzymes in your intestinal lining. Your body must work for up to 72 hours just to rebuild new enzymes and restore baseline filtration capacity. If you take a common blood pressure medication like amlodipine or felodipine, a single tablespoon of grapefruit marmalade, or a small glass of juice completely removes your body's defenses. The pill bypasses all filtration, and your bloodstream absorbs up to a 400% overdose of the medication. This causes an immediate, catastrophic drop in blood pressure, severe dizziness, rapid heart palpitations, and extreme internal organ stress. There is no safe timing window for grapefruit because its effects last for 3 full days. If your medication interacts with this system, you must eliminate grapefruit entirely from your home and replace it with safe citrus alternatives like sweet navel oranges or lemons. Let me share a story with you about a patient of mine named Robert, a 64-year-old retired civil engineer. Robert was incredibly meticulous about his health. He walked 2 miles every morning, kept a detailed log of his vitals, and took his daily dose of Lisinopril every morning without fail. Yet, when he came into my clinic, he was deeply discouraged and anxious. For 3 months, his home blood pressure monitor was showing erratic, dangerously high morning spikes. He was experiencing unexplained muscle fatigue and mild dizziness that was severely limiting his daily walks. When we reviewed his morning routine, we discovered that in an effort to maximize his nutrition, Robert had started drinking a large glass of calcium-fortified orange juice and eating a large bowl of oats with an extra banana at the exact same time he swallowed his medication. Without realizing it, the calcium was binding to his pill, the fiber was trapping it, and the potassium was clashing with his prescription. We made a simple change. We had Robert take his medication first thing in the morning with plain water, moved his breakfast to 2 hours later, and replaced the fortified juice with a cup of green tea. Within 10 days, Robert's blood pressure stabilized beautifully, his energy returned, and he was back to outwalking his grandkids on the trails. There was no magic in it. His body didn't need a higher dose, it simply needed the right raw materials without a morning conflict getting in the way. Now, after hearing how easily foods can interact with prescriptions, many patients ask me, Dr. Meyers, wouldn't it be safer and easier to just skip these fruits and vegetables entirely and take synthetic vitamin isolates instead? My definitive clinical answer is absolutely not. Whole foods are vastly superior to expensive synthetic supplement pills. A whole food functions like a full, masterfully conducted orchestra. The vitamins, minerals, trace fiber, and active polyphenols work together in perfect synergy to protect your cellular lining and reduce systemic inflammation. When you buy a highly processed synthetic isolate pill, you are essentially paying a premium for a single instrument playing at maximum volume, which your body often cannot recognize or absorb efficiently anyway. However, we must always keep a balanced perspective. Utilizing targeted dietary adjustments, optimal meal timing, and clean whole foods is designed for prevention, protection, and health optimization. It is never a substitute for direct professional medical diagnosis, prescription management, or critical diagnostic screenings such as colonoscopies, mammograms, or routine blood work. The nutritional and biological strategies discussed today are intended strictly for educational purposes. If you experience sudden, severe chest pressure, a sudden numbness or weakness on one side of your body, slurred speech, or a blinding headache, do not attempt to alter your diet or wait for a pill to work. Seek immediate emergency medical care. Always consult your primary physician or a licensed pharmacist before making any changes to your medication schedule or implementing radical adjustments to your daily food intake. To keep your cardiovascular system completely safe and protect your independent lifestyle over the coming week, let's establish a simple 5-step action plan you can implement tomorrow morning. First, write down the exact chemical names of all your blood pressure medications. Second, call your pharmacist and explicitly ask if any of your specific pills interact with dietary calcium, potassium, or the grapefruit pathway. Third, commit to the 2-hour separation rule, always taking your blood pressure medication with plain water at least 2 hours away from dairy or fortified juices. Fourth, keep your intake of morning greens and savory aged items consistent rather than introducing sudden, massive dietary shifts. And fifth, clear your kitchen of grapefruit-based items if you are taking a calcium channel blocker. As a final clinical tip to enhance your morning nutrition, remember our favorite fat absorption trick. Many of the vital, fat-soluble antioxidants found in your breakfast require a small amount of healthy, unrefined fat to cross your intestinal wall. Enjoying your morning meal with a light drizzle of extra virgin olive oil or a small handful of raw walnuts will massively boost your body's nutrient bioavailability. Taking control of your longevity is all about understanding the deep, elegant science of how your body works. But while we are on the subject of optimizing your morning habits, there is another massive danger hiding right inside your refrigerator. It is a common breakfast staple labeled as an all-natural heart helper that quietly accelerates artery stiffening and raises your overnight stroke risk twice as fast as refined table sugar. Click on the next video appearing right now on your screen, and we will unpack exactly what this hidden danger is and how to remove it from your kitchen today. I'll see you right there.